maybe going to you mentioned some exits. So yeah, Amolyt, I think it's end of last year, or is it already this year?
It was this year.
This year already?
Yeah. In March, yeah.
In March, okay.
April, yeah.
So then it's this.
Yeah.
It was Lyon,
Yes.
France-based company.
Yes.
Up above $1 billion deal.
Yeah.
Total biobox, 800 billion upfront, which is,
Yeah.
at least to my knowledge, I think it's the largest upfront, I think, ever in France, or at least.
Yeah, maybe the
What
second
kind?
after Advanced Accelerator. Yeah.
Okay.
Yeah. Really farm. Yeah.
Okay, yeah.
Yeah.
I mean,
Yeah.
it's impressive.
Yeah, it is impressive. Yeah.
It's and you guys, and I've seen actually the Series C with Sophie Noah coming in.
Yeah.
But I didn't know you guys were leading the Series A actually.
Yeah.
Which is even more
Yeah.
even more impressive.
Yeah.
Can you tell a bit more like on how you came to invest in the Series A and like
So this is I think this is a great story for Europe, by the way, and it really shows. And why do I say that? Because this is a story where the technology actually came from the US, from out of the MGH in Boston, and
that's why they were invested. Okay, now
yes, but the company got built by a serial entrepreneur in Lyon.
That's
France, yes, and Thierry Abriba, who has sold to other companies previously, and he brought his team on very quickly, got it up and running very quickly 4.5 years ago. That's when we came in alongside him, around it with some mouse data saying they may have a differentiated product for hyperparathyroidism and be the second to market after another one that's just ahead of them, which is up for approval now. So I think it was a European syndicate that a significant Series A financing. We co-led it with the EQT guys, and lots of other investors came in, a mixture of French investors who had been there earlier at the seed, but then they came in the A, and then kind of really trying to build a pan-European syndicate to kind of enable that advancement into the clinic. And then successive rounds, then next one by Andera in France, leading it, and then later on Sophie Nova coming in for the Series C, leading that last year, and then this year the company is being sold in phase 3, having delivered very exciting phase 2 data, but in 4.5 years, superb execution, moving something very early to that point. And really backed by overwhelming majority of European investors, and I think that's a great story. We advanced the company from a very early stage, successive rounds of financing, all the way we were funded to approval. Now we were preparing to launch, raise more money to launch it, and then we got the corporate interest. So I think it's a nice message to show that we can do it here in Europe.
That's amazing.
Yeah.
Actually, I wanted to at least the syndicate picked my interest because I think you have managed to gather, I think, almost all French VC in a single company, which I think I've never seen. Because being French and knowing them, they are always like, they don't like each other too much. They collaborate sometimes, but let's say Andera and Sophie Noah, it's quite rare to see them really on a deal together.
Sure.
So here, you had both of them.
Yeah.
And Kurma invested as well, I think.
Yeah.
And then
BPI.
BPI. But BPI invested often every French, every French biotech almost. But and then even like Orbimed invested and Pontifax as well. It's pretty great. And obviously you guys, plus some other investors. I want to ask, like, how did you manage to to get them all and all friends on the board? But I guess it worked well.
Well, the asset matters. I think the asset was very interesting. The management team matters. Thierry Abriba, if those who met him, is a experienced CEO. Maintains great relationships with all the investors. And has been really somebody who people can feel confident about executing well.
Okay.
And then, the investors who kind of came in, I think also very experienced in later stage, clinical stage opportunities, because it became a clinical stage opportunity. And there, the Software Nova Growth folks, I think, that's their focus. It was nice to have them there with the capital available to participate and really, help us shape that last round. So I think those are all the factors that kind of come in to it. And I think we've benefited from seeing that sort of early interest from, the local French smaller investors, and then the bigger ones with the bigger funds kind of come in later.
That's right. Actually, your last comment about the crossover. I mean, not just to complement Sophie Nova, but I think it's one thing that I heard a lot, let's say from 2015 to 2020 is always like, we are lacking crossover funds, we are lacking later stage funds in Europe, and this deal basically seems like a pretty good case study for a crossover fund.
I'm totally with you, and it's a very important point you pick up on there. We've had we've said, there's a funding gap at the very early stage. True, but there's also has been, and there is still a significant gap at the later stage. And when public markets are not active in the US, companies don't have the access to raise and dream about being, raise those hundreds of millions and to kind of go public and maybe launch drugs, right? Like we have many examples of US companies who didn't get bought, but they launched and there have been successful launches and they are now multi-billion dollar.
After launching and
multiple billion dollar companies and then, multiple $billion exits. We need more of that in Europe, and that needs scale capital. And it's great to see funds like, the Software Nova Growth folks there, but also now, we have the folks at Gilda. We have the folks at Forbion, and they've been dedicated funds raised now to do kind of growth capital, what would be classified as growth capital, where there is kind of a POC, and then you can sort of fund them to the next level. Yeah. And Novo is very happy to kind of come alongside those groups and really sort of help that piece. Now, have we got enough? I don't think so, because we have as we just saw and I mentioned, there was nothing raised for public European companies, in this last quarter. It's absolutely terrible for their ability to raise money. And I think that's a real gap that Europe has to address. And it's been a real failure, and we will not be able to succeed if we are totally dependent on all our companies attracting U.S. investors, going to NASDAQ. We should be self-sufficient here on the public markets as well if we want to really create the future leaders of tomorrow. So this is something
at least having options, I guess.
Absolutely. And so we need some of this capital, which is not investing locked up in pension funds, insurance companies, to kind of somehow get directed or allocated, or maybe the EIB through its policy measures, how it's helped with the venture funds, help create that sort of later group of specialist investors who can really carry these companies forward to the next level. And then we can actually then have, the future Gileads here in Europe as well. So,
That's it's good you mentioned the pension funds as well. I mean, when we talked about this discussion, you said it's mostly a policy problem.
Yes.
And I'm curious about this. What do you mean? And how much is it a policy versus let's say, return? I mean, if the returns are so good as you mentioned in the funds, why are European pension funds not investing more in funds?
Yes, I think the problem is at sort of two levels. One, there is a lack of understanding of what biotech is, because I think it seems very risky. All this funny jargon we use, the terminology, it's very hard for a non-specialist to access and understand what he's investing in. So that's one serious problem, which is inherent to our sector. But it doesn't stop the US guys doing it, right? So US journalists do invest in the sector. Why is it that we don't? So I think there's a risk problem as well. And I think Europe has still developing its equity culture and risk-taking culture. And I think there's a market failure. I could only characterize as a market failure because now this industry has been going for, 25 years plus, 30 years, right? And there's a clear track record. EIF has the numbers, and yet we're still having difficulty for LPs or institutional money really kind of allocating these very large pools of capital to risk. And so I think that market failure has to be addressed at a policy level. And that is where I think more work needs to be done in Brussels and, in London. And I think that there is some activity that's happening there. I think there's some recognition from the politicians that this has to be addressed. We have the TB initiative in France, and we had a Mansion House speech in London around it. I think we're at that juncture where we need to build some momentum here and really see some real actions being taken, which will have a consequence for the next 20 years for European life sciences. If we truly want to have life sciences as a core pillar of growth in Europe, we cannot do it without addressing the capital gap at the expansion level. So
it's crazy because, as you said already throughout the interview, I mean, if you have like track records and you have return multiples, I mean, as a pension fund, that should be the most important metric.
Yes.
Not like understanding how to do drug development. I don't know. I mean...
Yes, I think there's some rules also that get in the way, also around how they match, assets with liabilities and all those things. So
I think they're trying to evaluate their own risk level.
Yes, exactly. So, and how they allocate what level of risk they're willing to underwrite. So I think this is something that can be addressed. We've had two big moves at a policy level, which had a profound impact on the shape of Europe we see today. One is the EBRD setting up with Eastern Europe and integration into Western Europe, right? That was like a huge policy move. Imagine if that hadn't been put in place, right? What that would have what we would be living into now. And then I think the second part, which is more specific to our sector, was the way that the EIB set up in the 2000 timeframe to support venture funds in tech and life sciences, and seeded these VCs who were a cornerstone initiative.
They seeded almost at least every biotech fund, I think, has EIB.
They have massive. I think they have a statistic around it. It's like 90% of it or something like that. So it's and we have the venture industry. The reason we started off this conversation was around how it's positive today. If they hadn't done that, I don't think the private sector. We know that for a fact they would not have stepped in because they're still struggling to step in now. So they certainly would have not stepped in then. We would not be having this conversation here sitting in Europe. So it is important. It is something that has to be addressed, and it is important that now policymakers really pay attention to this and fill the gaps in. Yeah.
If some policymakers are listening, do your research or reach out.
Yeah.
Maybe one last thing, a bit on the macro level. Yeah. You touched on it when we talked about bringing all the syndicate of Amolyt, and on the board level, and that's. The people were like getting along. Yeah. And I think, and we discussed it before, I mean, biotech is still a people game. Obviously, you have scientific data and everything, but still, I would say 50+% of the success is people.
True.
Can you I'll talk a bit about it, of why is it the case? How you apply it in your investments, like how you filter out, or you mentioned even within a fund or within a company, there's some people you will work more with and not.
So Amolyt is a great case. I think this was a story where there was an incumbent drug, and you had to differentiate the drug, and convince investors that you're going to have a differentiated story. Right? Because you need to raise money. Investors are very focused on, do you have a differentiated drug? And then there are people who are willing to give you some backing and willing to give you lots of rope, and others who want to see, results today or tomorrow, right? And you have that in all those discussions in a broad church like Amolyt had of lots of investors, right? And you do have people who have different perspectives around that.
10 more people on the board.
Yeah, it's a big board.
It's a big board. Yeah.
I was like, are we going to be able to navigate this? So I think But we did, and I think the reason I think it worked was not because people held back and didn't express their views. I think what was, what our observation for me from the Amolyt case was the role that the CEO played, and also the chair played, and also a little bit of sophisticated investors, making sure that they're listening as much as they're talking. In the room.
2 years and 1 month.
Yeah. I think you need both. You have two faculties. You should use both. And I think we saw a good example of that being used. And yes, we had to make some important strategic decisions. It was a robust discussions at times where we were not fully seeing eye to eye. And I think it needed. But what was important was I think everybody was trying to aimed at the same goal, right? Yeah. Which was, we want to make sure that we can raise good money, we do the right experiment, and we can show the right differentiation, and we have the best team possible, that we recruit the best team possible to do that. And we cannot do this on a shoestring. You need to have a reasonable amount of resources to do this. And you need to build a story that will appeal to a international audience, right? It'll also appeal to US investors, etc., as well as European investors. So I think we were looking for all of those things. We had an opportunity maybe to think about going public earlier. There were sort of situations when the markets were very strong. I think there was a big push to try to take this public as part of that wave. I think there was quite a lot of discussion around that because some of us were a little bit weary about a French company that didn't have data, trying to go public on NASDAQ. And what that outcome might have been. I think it would have been tough if we had done that for various reasons that didn't go as some people wanted it to.
I guess it's the right
but ultimately the decision was right and the outcome was right. But we had a robust discussion at that time around it. And yes, you have management who have a perspective.
Like your robust discussion. I can imagine the more like heated discussion.
We try to keep it not too heated. But but I always try to be respectful. I think very, very important that these are never there's no really ever a right or wrong answer. These are judgment calls, right? And sometimes you get it right, sometimes you get it wrong. And we just hope that we can build enough coalition to whatever we think is the majority view and kind of just get there. Yeah,
that's cool.
Yeah.
Maybe just before moving to your personal background, I just want to mention one thing, which I think we've discussed and which I think illustrates also well where the European ecosystem is now. And we've literally three biotechs now that are worth 20 billion plus.
Yes.
Argenx, Genmab, BioNTech.
Yeah.
And on our call, you even said BioNTech was at like 80 billion.
Yes.
I mean, and I think some people don't even realize or know. I mean, even myself, I thought it was Sander from Forbion, and I thought, Argenx I thought it was still at 10 billion.
Yeah.
Actually, they doubled.
Yes.
So I think it's also important to mention, like, just looking at the market cap.
I think it's super impressive.
Impressive. Even Bahija from Immunocore.
Yeah.
I mean, I think they're, I would say, number 5 in Europe, but I mean, 3 or 4 billion.
We should celebrate our successes.
Amazing.
We should talk about them more. We should make sure people are aware because, maybe as an industry, what we're doing a bad job is actually talking about our story.
Yeah.
And, we're Europeans. One of the things that we always criticize ourselves is that we're not good storytellers, right? Actually, we have a fantastic story to talk about. And it's something that we should sharpen our act.
We have a great podcast to highlight it.
Yeah, thank you for doing this.